Soroosh, congratulations. You received an ASQ grant. The grant helps young nephrologists living in low-income countries to attend the Congress, the ERA-EDTA Congress. Can you tell us a little about yourself, for example, where you come from and where you work as a doctor?
Thank you. My name is Soroosh Shekarchian, and I'm a general practitioner from Tehran, Iran. I've been working in nephrology research, mainly on stem cell and regenerative medicine fields. I have been working in this field since 4 years ago, and
That's it.
that's it.
Okay, and you have submitted an abstract which was accepted for the presentation at this Congress here in Copenhagen. What was the abstract about?
You know, when a patient reaches end-stage renal diseases, peritoneal dialysis is one of useful modalities. However, due to some complication, patients experience, peritoneal fibrosis, mainly due to some fibrosis process and inflammation process. And it has been stated in some experimental models that some kind of stem cell therapy, mainly mesenchymal stromal cell transplantation, could be useful in these settings. So that based on the review literature and our experience of using this specific type of stromal cells, we designed a phase 1 human clinical trial. We recruited 9 patients. We infused autologous adipose tissue-derived mesenchymal stromal cells and followed them for 6 months.
Okay.
There were also 10 patients as control group, and we assessed safety and feasibility of the procedure as primary endpoint, and some parameters regarding peritoneal membrane function as secondary endpoint. Totally, at the end of the study, we showed that this intervention could be feasible and safe in peritoneal dialysis patients with ultrafiltration failure. And there was also a mild improvement in peritoneal membrane function. However, due to a study design, limited number of patients, it limits us to draw a conclusion on efficacy.
Yeah, so perhaps a phase 2 study will follow now?
Yes, we are going to design phase 2 study, and the result of our phase 1 could be a foundation for efficacy assessment by a large randomized clinical trial.
Okay. And have you enjoyed the Congress in Copenhagen so far? And which sessions did you like best?
It was a really interesting event for me so far, and the session regarding gene therapy by Professor Tony Katsuman was really interesting event, which I've attended. In general, these 4 days conference is very interesting to me, mainly because of the nephrology fields and some newly added sessions regarding basic science, gene therapy, cell therapy, and these kind of.
So you received the grant, and this enabled you to come over for the Congress. So would you encourage other young doctors to apply for it?
You know, this is my second time that I've been awarded a travel grant by ERA-EDTA, and this is my second presence in ERA-EDTA Congress, mainly due to award from ERA-EDTA and absolutely help and support from Rion Institute. And I really encourage other scientists, other researchers to apply for such grants. It would be a unique opportunity to attend such scientific congress.
Okay, thank you very much, and we are happy that you're here.
You're welcome. Thank you very much for invitation.